as the government works on encouraging more people to be inoculated, a health expert believes certain kinds of vaccines are more suited for a specific age group. Joining us now on the line is Dr. Leo Olarte. He is the former president of the Philippine Medical Association. Good morning, Dr. Olarte. Thank you for joining us on New Day.
Yes, good morning to Madam Ria and to everybody listening to your program. I am Dr. Leo Olarte, president of the Clean Air Philippine Movement Incorporated.
Now, Doc,
president also PMA.
Right. You said na depende sa edad ng tao ang vaccine brand na dapat gamitin. Why is this important? Hindi ho ba lahat ng vaccines appropriate sa lahat ng tao regardless of age?
Yeah, generally speaking, lahat vaccines can be used in all ages, except for children, where clinical studies have not yet been released. But there are certain specific vaccines that are better for certain ages. Halimbawa, yung Pfizer and Moderna. Why? Because Pfizer and Moderna uses the mRNA, messenger ribonucleic acid molecule, to send signals to the cells. So the cells must be healthy. They must be in good condition. It's better if the cell is from a younger age group, like age 16 or 18 to 65 years old, where the cells are in good shape. So Pfizer and Moderna are best for this age group because they use the mRNA molecule, which sends signals to make spike proteins, which will induce the body to produce antibodies to the spike proteins.
That being the case, Doctor, what would you say is okay for seniors over 65 to take?
Okay, for seniors, we can have AstraZeneca and Johnson & Johnson, Sinopharm, Sinovac, because they use viruses, attenuated viruses or dead viruses. Novavax also can be used for these senior citizens. Now, the reason is that these kind of vaccines do not use mRNA. They use viruses itself. And the virus stimulates antibody formation bypassing the cell. So we know that the cells in senior citizens are already they are already older, degenerated. The responses are not as good as the body cells in a younger age group. So that is the reason why we recommend mRNA molecules, which are used in certain vaccines like Pfizer and Moderna for ages 16 and 18 to up to 65 years old, and beyond 65 years old, vaccines that use attenuated viruses or dead viruses.
Okay, Doc,
like
you also said, sir, that public officials should make public their vaccination. Why do you say so, sir? And aren't public officials entitled to some of their own privacy?
Yes, they are entitled, but this is a pandemic, and we are promoting the trust. We are promoting trust and confidence in the use of vaccines because there is a good number of people who do not want to receive vaccination. Ayaw nila na makatanggap ng vaccine because of the long-term effects and the side effects from the vaccine. So in order to promote trust and confidence, our public officials like the senators, cabinet members, congressmen, mayors, governors should, as much as possible, pag dumating na yung turno nila, kasi turno-turno yan, pag dumating na yung turno nila to receive the vaccines, they should have it done in public para it can incite confidence, promote the safety and effectiveness of the vaccines.
Now, sir, just a few days ago, the government rolled out their vaccination plan. Do you think our healthcare system is ready for the vaccine rollout?
Yes, the Philippine Hospital Association members are ready. They are ready to vaccinate the people. So there's no problem with our healthcare workers, the medical personnel, the doctors and the nurses. They are trained to give the vaccines, to administer the vaccines.
Now it's just a matter of waiting for those vaccines to arrive. Thank you so much for your time this morning, Dr. Leo Olarte. We do appreciate it.